Welcome to the Everything Drug and Alcohol channel. Today, we're honored to be joined by Dr. Alta DeRoo, Chief Medical Officer of the world-renowned Hazelden Betty Ford Foundation, one of the most respected addiction treatment and recovery organizations in the country. We're diving into a meaningful conversation about addiction, recovery, mental health, and the reality that addiction does not care who you are, impacting everyday families, professionals, athletes, celebrities, and communities, not just across America, but across the world. This is a discussion about healing, awareness, and hope. I'm your host, Greg Henderson. Let's get into it. Hello, and again, everybody, this is my guest, Dr. Alta DeRoo, as you heard her bio earlier, so I'm excited to actually have her on, and when I posted it on my social media, everybody started asking questions because it goes outside of my scope of audience when it comes to what I do, when it comes to drug and alcohol testing world. But before we get into all of that, again, welcome to the show.
Thank you.
Awesome. So before we get going, how did you get drawn into this work, and how did you become connected to the Betty Ford Clinic?
So I spent a little over 20 years in the military. Towards the end of the military, I became board certified in addiction medicine. And I started practicing addiction medicine in the military. And then when I retired after 20 years, I started practicing heavily in the Mid-Atlantic area, working in some methadone clinics, and becoming of addiction medicine. And a lot of my focus with medicine then shifted towards treating OBGYN patients, because I'm also an OBGYN. And patients with substance use disorder. And then, my practice started growing. And this was around 2016 through 18 when the opioid crisis was really hitting us hard. And it was also about that time that the people at Hazelden Betty Ford called me up and asked me to come interview for one of their medical director positions. And now it's become the focus of my life. It's become my life's work now.
I did not know you were in the military. I'm retired as well. So,
oh, great. Yes. We're in good company. A couple of patriots today.
I did not know. So one of the things that, I know we were speaking off air about what do I actually do, and you kind of said, okay, I'm interested in learning more about what you do. And so
yeah.
I'm a retired military as well, so I did drug and alcohol testing while I was in the military. Then I retired and went to Department of Interior. So I was a drug program manager at Department of Interior, so I was a part of, overseeing drug testing for the federal government, and that means the executive office of the president, all the way down to, an intern. So we would do the FBI and all the 3 agencies and stuff like that. Then I left and went to the Federal Aviation Administration, where I did drug and alcohol enforcement, inspections for aviation industry. So whether it's mechanics, pilots, or contractors. So we're making sure that they're in compliance with drug and alcohol. And a portion of that also comes with the second chance rehab, program as well for these safety sensitive people, not just in the federal government who oversees the Nuclear Regulatory Commission and all these other places, right? And so as these things are all connected, I wanted to, because of me dealing with high profile people in the space of the federal government, that's what kind of drew me to your world, which was the celebrity world of, what Betty Ford is really known for to us, but maybe you can educate us on that you guys are much more than just, dealing with celebrities and high profile people. So that's kind of how it all comes together.
Okay. All right. Yeah, we do have a very strong history of treating high profile people, and I'm not going to mention any names because we're all about anonymity. but we've had the majority of our high profile celebrities or high profile folks come to our Betty Ford Center location in Southern California, which is about 100 bed facility. And then also up in Minnesota, where I am today, kind of cold up in Minnesota. We have a 200 to 250 bed capacity up here, and we have a lot of high profile people coming to visit us. And it's not just the celebrities and high profile people. What happens is that those folks get sober with us. And, once you have gone into recovery, or if you know somebody who's in recovery, which almost everybody does these days, they see the benefits of it, and then they share it with their family and friends. So not only do we take care of a lot of high profile people, but then they tell two friends, and then they tell two friends, and so on and so on. So it becomes like their extended relatives and family and friends that might need help. So they share their positive experience and their sobriety with their circle. And so we treat their extended family as well.
So it's funny you say that, because I was thinking of we were talking about TMZ off the air and
Yes.
whatever. So do you find anybody or have you heard while you were there or prior to you coming there, of individuals just trying to come to rehab so they can interact with these celebrities that are in rehab?
I think that there's always a buzz about that. We can't ignore that. People always talk about, am I going to see this person? I'm going to see that person. And sometimes it happens, sometimes it doesn't. And, also keep in mind that we do our best. We do a very good job of protecting the anonymity of anybody coming to see us. So there's always a chance of that happening. And I have heard that patients kind of excited about the possibility. So that is part of it. But I'm always really impressed with our patients and staff on how professional they end up being, because once those people get here, the addiction that's being treated is the great equalizer. So even though you may have somebody who is a high profile person, or let's just say they're a pilot, doctor, lawyer, something like that, that even outside of treatment, they have a high profile. A lot of politicians, once they get into addiction treatment, it is that leveled playing ground, and the addiction and the treatment is very much the same. So yeah, there is that little bit of buzz.
That little bit of buzz. I always thought that was interesting, because you see on TV how the movies would portray all of them sitting in a circle, all the celebrities.
That happens.
That happens, yeah.
That happens because when they're here, or when celebrities even go to other places, they benefit from the experience, strength, and hope of their other people that they're recovering from. So their stories help them reflect on their own addiction. But yeah, sitting around in circles, that really talking about their experience really does happen.
That's good. And we talk about celebrities a lot, but when we talk about high profile people, that could be someone important to a community, a high profile to a community, not just a actor or, whatever. So, I want to just kind of clarify that it's not just about celebrities, because celebrity is who we deem to be that celebrity, right?
That's true. Right. The celebrities are only because we make them celebrities. We're celebrating them. Yeah. The high profile people come in as well, and they could be high profile people from the community. And I'm really glad that you're bringing that up, because that shows that addiction does not spare people who are at high profiles, or people who are just commoners and do the work every day, like you and me. So there are people that are afflicted with the disease of addiction at every strata of life, just the common person, the worker bee, like you and me, and then also those ones that may hold some type of special office. So it doesn't discriminate.
Right. And in my world of dealing with the, executive office people and all this other stuff. So take us back to Betty Ford. How did her personal story influence this mission and direction? Because you think of a first lady, you're not thinking of this, right? Like,
What an amazing person she was, an amazing person. So, of course, she was the first lady of Gerald Ford, and she was afflicted with both breast cancer and addiction. And at the time, back in like the 1970s, when this started happening with her, people did not talk about either of these things. Breast cancer now is, the wearing the pink ribbon and having the walks, and people celebrate the recovery from breast cancer. But back then, that wasn't something that women talked about. And so that was one of the things that she brought forward, was this public announcement that she was suffering from breast cancer. And then she got treatment, and she wanted other women to know about the breast cancer. So she was a trailblazer in that one sense. And then after she recovered from breast cancer, she continued her use of pills and alcohol. And it was very much in that social scene of growing up, like in the executive office that you're probably familiar with, entertaining, having the parties, a little bit of social anxieties. She was also a dancer. And so when you read her biography, it just talks about how this became part of her life, how entertaining and the drugs and the alcohol became part of her life. And it was finally when her family intervened and expressed their concern about her use and how it was affecting the family. She sought treatment, she got treatment, and she wanted the world to know about this. So there was another, that's how she became a trailblazer again, by being so open about her drug addiction, because everybody in America knew somebody that had been affected by alcohol, which was the predominant thing at the time. So, their alcohol and morphine use and cocaine was still a part of America back in the 1970s, but not many people had a word for it, such as substance use disorder or addiction. So finally, she made it known to folks. And one of the reasons why she also disclosed about her drug addiction is because she wanted to empower other women who were suffering in silence. When we take a look at the Alcoholics Anonymous, it was started by two men, and their wives were very supportive and very grateful that it was started by two men. But it seems like the women were also equally susceptible to this, but their story wasn't being told. And so by Betty Ford sharing her struggles with pills and alcohol was a way to make it known. And then in the 1980s, she established the Betty Ford Center in Southern California. And this is, it's located in Rancho Mirage, which is shares the border with Palm Springs. And so a very big place for celebrities to go and vacation. And then it became a place where celebrities and also high profile people would go to recover. And I was the medical director there for 2 years before I became the chief medical officer of our whole organization. And it is still that beautiful campus. It is, if I were to send a loved one to treatment, there's no doubt in my mind that the Betty Ford Center would be one of the most beautiful places to recover.
and she was in a time, of course, before social media and all this other stuff. So how do you guys now balance the honoring of that legacy, from the past with the evolution of today's challenge with, addiction and mental health,
Yeah.
We have fentanyl now and all other kind of stuff going on.
So her legacy at the Betty Ford Center is celebrated every day. From the moment that you walk through the doors and you see quotes from her up on the wall, you see pictures of her, there's a bust of her when you walk in, there's water fountains, there's a picture of her and President Ford when you walk in. The whole facility embraces her legacy of substance use disorders. There's pictures of her even when she was still alive coming back to the Betty Ford Center to actually meet with patients. And so we keep that legacy alive by the pictures, by telling these stories. We also have a historian within the Betty Ford Center that keeps all of this memorabilia going. And we celebrate her sobriety date every year. In fact, our address in Rancho Mirage is the part of the address is her sobriety date. So everything is about a celebration of her sobriety and keeping her dream and her legacy going. So we have reunions every year to remember her legacy, reunions of people who have gone through the program, and alumni come and celebrate on her sobriety date, as well as, just an alumni weekend. And so that's how we're able to keep her dream and her legacy alive. It's very much at the heart of the Betty Ford Center, if anybody were to go down there and see the facility. As far as the mental health part of it goes, because you were asking, how do we balance that? So at the time, it was known that people did have mental health struggles. And so there were psychiatrists and psychologists on staff back at that time. And what we've done, because we've grown so much, we have many more psychiatrists on staff and psychologists on staff. And so while we offer substance use disorders treatment, we also offer co-occurring mental health treatment, because 90% of people with substance use disorders also have a co-occurring mental health affliction, most common anxiety and depression. And so we've developed programs now, our co-occurring programs, they're called co-enhanced programs, where we actually have a robust curriculum about mental health, trauma. Suicide is a big discussion and a big attention grabber for us. And so we now treat the substance use disorder and the mental health outwardly. Before, we would advertise that we just treat people with substance use disorders. The mental health part was always there, but now we're much more public about how we treat the mental health while we treat the substance use disorder.
So one of the things that you're talking about is the mental aspect of it, and again, bringing back the high profile people into it. Do celebrities or high profile people experience addiction differently, or is it fundamentally the same struggle regardless of the status?
The disease is the same, but sometimes it differs on how they got there. When you have a high profile person, sometimes they have a lot of access to drugs and alcohol that other people would not. They also have a lot of people in their life maybe enabling them, and some of those boundaries may be blurred. And so their access to drugs and alcohol may hasten their substance use disorder, may hasten that disease. When they come in for treatment, the treatment of addressing mental health and the treatment with medicine is very similar. We do individualized care. But in one of the ways that it is different is that when we get into the groups and we have what we call our professionals group, the struggles about returning back to a sober life can be different for high profile folks than it could be for other people. There's a lot of shame and stigma with returning back to the community of once, being in this high profile position, being perched at a higher level than other folks, and then being normalized and equalized as just a regular common person going through life. So in the groups that we have with our professionals, we talk about the struggles and the shame and the stigma that they may encounter going back into circulation again with their high profile job. We also talk about relapse prevention. Relapse prevention may look different to a high profile person having access to all these drugs and alcohol represented into their life, engaging in parties, expectations that maybe the industry has. So those are some struggles that the high profile person have that maybe just a regular person in the community does not have. And so our professional groups, those professional groups address that.
So then I would say that the role of the family, friends, or support system is very important in the recovery phase.
Crucial. And I'm so glad that you're pointing that out. So we have a family program that we strongly encourage all of our patients to engage with. The family program is very robust around all of our sites in the United States. And there's a lot of evidence that shows that a person is more likely to be successful in recovery when they have the involvement of family and friends. And just to expand on that a little more, it's not that your family and friends just support you, but perhaps when you get out of treatment and you want to attend an AA group or an NA group, well, when that family member knows that that's what you need to protect your sobriety, the family member is much more understanding when you have to miss some other family event to go to a meeting to protect your sobriety. Having your family and friends also aware of your struggles allows them to set up an environment free of alcohol and drugs, then to support you in your success. So lots of reasons
What
to
do
have
you
family
think?
and friends. Mhm.
What do you think that the loved ones get wrong most of the time when someone is struggling? Like, what do
Wow,
they?
that's a great question. So I often hear from family and friends that the patient now is fixed or cured and that it's over. We sent you to treatment. You should be all better now. We sent you to a place to cure your addiction. And the recovery road is long and there's no simple fix for addiction. So I think that family members often misinterpret treatment as a fix. It's not like you're going in for a surgery and you had an appendicitis and you're getting your appendix removed and now you're all better. That treatment that they get at our residential facilities when they're with us for 30 or 60 days, that's just the beginning. And then the rest involves going to groups, maintaining a relationship with some type of counselor. And so that's probably the biggest mistake. Or another misconception that they may have is that we sent you to treatment and now you can learn how to drink responsibly now, or you can use responsibly. We sent you to this place, no longer you're addicted, but having a drink now and then is okay. So friends and family would really benefit to know that if they reintroduce these drugs or alcohol into this person's life, then they're putting their sobriety at risk.
I know you mentioned relapse, and it was clicking in my head about the relapse part. Is it actually a part of the process, or is it a sign that something went wrong? Like when we talk about relapse, and the reason I'm asking this is because I'm dealing with safety sensitive stuff in my world. We're companies, there's a lot of them who say, I don't want to have anything to do with this second chance, that I'll give that to somebody else to do. And then we have companies who say, oh, there's a shortage of these safety sensitive people, whatever. We need the pilots, we need truck drivers, we need this. So we're going to be a second chance employer. And I guess I'm going to my question is when we're talking about relapse, and is it part of the process or is it a sign that something went wrong? Does the type of addiction that they're on plays a greater part of their relapse or the ability to overcome from it versus, let's say, someone on marijuana or alcohol versus someone who's on crack or, something a little more heavier?
You ask such good questions. So
the military.
So right. So the definition of addiction by the American Society of Addiction Medicine is addiction is a chronic, relapsing, but treatable disease. So while I wouldn't say that a relapse is part of the process, it can be for somebody whose coping skills may not be there yet or may not have learned everything they can about recovery. Not everybody relapses. If it happens, it's not a failure. It's not that things didn't work, like you were asking. It's more that there was a gap somewhere in the patient's recovery system, a gap of either learning, a gap of a coping skill, or somehow there was a situation that made them more vulnerable and they weren't protected in that situation. So even though I wouldn't say that relapse is part of it, it does happen. It's not a failure. It's not a moral compromise. It can happen. It doesn't happen to everybody. Does it happen with I was hearing you ask, does it happen with certain drugs more than others? So alcohol and opioids are probably the most difficult to recover from. Alcohol, just because we sanction it as a society as an acceptable thing. When somebody gets inebriated, sometimes we think that that's funny and we celebrate it. And there's alcohol everywhere. There's alcohol on every street corner where there's a drugstore or a grocery store. So it's very difficult to recover from alcohol if you're constantly exposed to it. The part about recovering from opioids is that there's a physical withdrawal. And the standard of treatment for that physical withdrawal would be an opioid replacement, which is called buprenorphine or buprenorphine naloxone, which is Suboxone. And so the reason why I say that it's difficult to recover from opioids is not everybody embraces that medication-assisted treatment. People can do just fine without it. But if they don't get that medication-assisted treatment, the cravings can be very intense and they may want to use again.
So does age play a part? I know you said experience, but it comes in all ages. It's not just grown.
It does, yeah. In fact, we have a young adult and emerging adult facility in Plymouth, Minnesota, where we treat people ages 14 to 24, and it affects them. It affects the kids. It's a lot of alcohol and marijuana. And then we see at the Betty Ford Center, mostly an older adult population. We've seen people in their 70s and 80s. In their 70s and 80s, it's more likely to be alcohol, right? So they've probably been drinking their whole life. And then in their 60s, 70s, or 80s, the body can't keep up with the poison of the alcohol anymore. So you start seeing the liver failure. You start seeing how it affects the brain. It hastens dementia, increases some opportunities for cancer. And so it's when the body starts giving out that a lot of people say, hey, I need to get treatment or I'll die like this.
And I deal a lot with celebrities as well, in my world as well. And a lot of celebrities that I interviewed, I noticed a common denominator when they talk about how they became addicted. And I just want to kind of talk about that real quick. Like most of them were talking about pain. They started with pain relief, and then it just started getting, more expensive to try to get the pain medicine. So they resorted to other drugs, and then next thing you know, they're addicted. Is there truth to that?
Yeah, there is, and that's a very common pathway, even for celebrities or non-celebrities. Somehow somebody gets into an accident, motorcycle accident, car accident, and they have this back pain, which seems to really be a factor for folks. And they start out by taking safely prescribed opioids. But the problem with that is that if the chronic pain isn't appropriately addressed, then the person will start taking more and more opioids till the point that they can no longer be safely prescribed those opioids. So you also see the doctor saying, I can't prescribe you all of these, bottles of 90 with 3 refills of oxycodone. And that's where we do see some folks turning to alternatives for opioids. And those alternatives look like morphine, heroin, or fentanyl. There's not a lot of morphine and heroin out there anymore. It's pretty much all fentanyl. I mean, I constantly write little notes to the cartels in Mexico saying, please send me more heroin, not so much fentanyl. I'm kidding. But they don't listen. They just keep on sending the fentanyl. But yeah, there's not much heroin. And heroin, very good at protecting relieving somebody's pain because it works directly at the opioid receptor. And then also fentanyl is something that we use in surgery. We use it as anesthesia. So it's very good at correcting the pain. So when somebody escalates from pills that they're given to fentanyl, I can totally see that happening. And it's not just isolated with high profile or celebrities. It's also very common in just the general population. So again, it's that addiction is that great equalizer.
Right. And that's why it's important that when we talk about when someone tests positive on a test for drugs, that they have a current prescription, right? That you're
Yes, yes. And I really liked how you phrased that. When somebody tests positive for something in their urine direct screen, as opposed to somebody saying that their urine direct screen was dirty. Right. And so, you're a professional, and I recognized immediately that you use the correct terminology because we want to describe that urine for what it is. A person isn't dirty and their urine isn't dirty. Their urine is positive for something like fentanyl or opioids. So good call.
thank you. Thank you. I'm gonna put that down.
Yeah.
I've never even used that term before, so I have no idea that, I've seen it in the movies, but that's
Oh, well, great. You picked up on it really well.
never really. Now I know
Yeah.
not to use it. Now I know not to use
Right.
it.
Great.
Right, so I have a couple more questions before I let you go, and these are kind of like my last two, and I think they, kind of more heavier. I think. What's the hardest part of recovery that most people aren't prepared for?
Probably the cravings and the withdrawal. So the withdrawal is short lived, and we can medicate that depending on whether it's alcohol, benzodiazepines, or opioids. We provide medications to control your risk of seizure, to reduce your risk of seizure. So I think the amount of medications that it takes to make somebody comfortable in the first couple weeks is very difficult. The intense cravings that they're going to have. And then the other one, which people may not realize, is the insomnia that comes along with all of these things, except for methamphetamine withdrawal. Methamphetamine, they just want to sleep. But, after they stop using stimulants like methamphetamine and cocaine, they just want to sleep. But if you're somebody who used opioids, alcohol, or benzodiazepines, it is alarming sometimes when folks are like, I can't sleep. And it's this rebound insomnia because you've taken away the substance that was a central nervous system depressant. So you had something that was supplying a brake, putting on the brake to all of your activity in your brain. And now you've taken your foot off that brake. And it is very difficult for people to get to sleep. It is probably one of the biggest concerns that patients have when they seek medical attention with us, is that the insomnia is very difficult. And what we would do for that, sometimes it's one of those things that time is going to help out. People think that we have a magic pill to cure their insomnia while they're in treatment with us. And we have some non-habit forming medications that we can use, but there's not a magic fix to that insomnia. Sometimes it's just the brain healing and getting back to normal. So I would say that the cravings, the discomfort, and the insomnia are probably the biggest surprises.
So with insomnia being that, does that lead to another addiction to sleeping?
It could. Yeah. And we would not prescribe those sleeping pills here. So we wouldn't prescribe Ambien or Xanax for sleep. We don't prescribe those. I would hope that when somebody completes the residential part of our treatment here, 30, 60 days, 90 days in some situations, that by then your body is starting to normalize. So I'm hoping that once they were to leave treatment with us, that they wouldn't seek the sleeping pills. Yeah.
When you started saying, I was like, man, does that lead to something else, And so if someone has that addiction, is it easier to get addicted on other things as well because they initially have that addiction?
Yeah, and you're talking about a cross addiction. So absolutely, there's something about the brain that is chasing some type of feeling, and that's where coping skills come in. That's where regular counseling comes in, meeting with a psychiatrist, meeting with a psychologist. So yeah, that's always going to be there. And that's where the counseling part really comes in. And so the medication and the initial treatment's only part of that. And then there's ongoing therapy.
And before my last question, this just popped in my head. Everybody has a feel-good story, right? Is there any one particular situation that just sticks with you, that's like, oh my gosh, I'm so proud of you. You know what I mean?
Yeah. Boy, I am not a crying person, but this is always a tearjerker. So,
due to unexpected technical difficulties, we unfortunately had to cut our interview short. We sincerely appreciate your patience and understanding, and we want to thank Dr. Alta DeRoo and the Hazelden Betty Ford Foundation for taking the time to join us for such an important conversation. Despite the interruption, the discussion was meaningful, insightful, and a reminder of the importance of continuing conversations surrounding addictions, recovery, and mental health awareness. See you on the next one. Much love.